You have heard the word peptide in skincare, fitness, and wellness. At Allegra Dental Center, the question is more precise. Can peptide technology help protect this tooth before the surface breaks down? The word peptide is everywhere right now. It saturates social media feeds, biohacking podcasts, and longevity regimens, and your awareness in those spaces is valid. But stepping from that noisy wellness space into the quiet, clinical reality of a dental practice requires a shift in thinking. Medical intervention demands extreme specificity, not a reliance on what happens to be trending online. Evaluating any healthcare innovation means stripping away the consumer marketing to look closely at microscopic mechanisms and strict clinical boundaries. That clinical focus matters most during a routine exam when a specific scenario arises, the discovery of an early enamel spot or a white spot lesion on the surface of your tooth. Historically, finding an early spot forced patients into a frustrating binary choice. You could watch it passively and hope it didn't worsen, or you could simply wait until the decay progressed enough to require a restorative drill and a filling. That creates an uncomfortable tension. Most patients want to proactively protect their natural tooth structure, and they want to do it before the enamel surface actually caves in. This animated decision path maps out a potential middle path. Between passively waiting and actively drilling, the goal is to intervene early for these highly specific, non-cavitated lesions. Curodont enamel regeneration offers a way to fill that exact gap. Peptides may be trending, but at Allegra Dental Center, the focus is precision: the right tooth, the right stage, and the right treatment after a careful exam. The anatomical prerequisites for this treatment are absolute. The lesion must be in its earliest stages, entirely non-cavitated, and the outer layer of the enamel surface must still be completely intact. The clinical evaluation goes beyond the tooth itself. The dental team looks at your daily oral hygiene, diet risk factors, bite forces, and whether that specific spot can be reliably accessed and monitored over time. As we see on this candidate criteria checklist, peptide technology is not a universal fix. It is a highly targeted medical tool deployed strictly after a comprehensive diagnostic exam confirms you meet all the requirements. To understand why those criteria are so strict, we have to look at exactly how Curodont interacts with a compromised tooth at the microscopic level. This cross-section shows an intact surface with a weak, porous subsurface. The Curodont peptide self-assembles into a microscopic scaffold inside the weakened enamel. This scaffold actively attracts calcium and phosphate from your saliva. These accumulating minerals support new hydroxyapatite crystals, densifying the tooth. It does not artificially patch the enamel. Instead, it uses biomimetics to actively support your body's natural remineralization process at the exact site of the weakness. Curodont is not for every cavity. If decay has already broken through the surface, or the tooth is structurally compromised, a filling or another restoration may still be the healthier choice. Once the physical enamel surface collapses, the opportunity for this specific type of regeneration closes. Traditional restorations remain the responsible, medically appropriate way to treat cavitated decay. And even when regeneration is possible, the patient's role is non-negotiable. Diligent at-home plaque control, managing your diet, and keeping your follow-up appointments are mandatory for the process to actually succeed. True dental precision requires a practitioner who knows exactly when to lean into conservative regeneration and exactly when to rely on traditional restorative dentistry. For the correctly diagnosed candidate, the ultimate goal is straightforward: preserving your natural, original tooth structure for as long as medically possible. It provides relief. Instead of sitting in limbo and waiting in fear for an early spot to turn into a filling, you have a proactive, non-invasive plan. If you have been told you have an early enamel spot or a white spot lesion, you do not have to guess at your options or assume a drill is inevitable. Book an appointment to find out if Curodont enamel regeneration is right for your tooth.